Hello guys, and welcome back to another video. Today we're in a clinic, which is funny because the topic of today is the General Dental Council's 9 standards for the dental team. Now, these guide ethical principles in dentistry, and what we're going to do is go and have a whistle-stop tour of the core parts of each one of these principles so that you can talk about them in your interview. A lot of the ethical questions that come up in interviews are centered around principles from these guidelines. So what the aim of this video is to teach you some of the core expectations from the GDC so that you can show a better understanding of how to tackle ethical issues within a dental scenario. So let's get into it. Principle number 1, put your patient's best interest first. Now, it sounds like that sounds quite obvious, but when you dive into it, what does it actually mean? Part of that principle means to avoid discrimination and treat every patient the same regardless of their protected characteristics. And this comes under the Equality Act of 2010, where we can't discriminate on 9 key factors, some of those which include religion, gender, age, etc. Another key part of this principle is to treat patients in clean and hygienic environments, and to also ensure that everybody treating a patient is actually qualified and has the registration to provide a treatment. Another core part of this principle is to get patients involved with their own treatment plans so that they can collaborate with you to make a decision on what they want to do about their own care. Another core part of this principle is to act honestly and with integrity. So that means you can't falsify information or reword information in a way that would convince patient to go ahead with a treatment that would be in financial gain for yourself. It's about doing what's best for the person and presenting them those options and putting them in a way they can understand. That leads nicely onto principle number 2, which is communicate effectively with your patients. Now, communication is a range of different things. It's the words you say, it's also the body language that you have as well. And it's also the way you present information, and it needs to be in a way that patients can understand. Often when you're talking to patients, you're presenting them with diagnoses, treatment plans, and they won't understand what this means. So you have to simplify it in a way that they can absorb and take home and make decisions with. And that's why we need to remove jargon from our speech and simplify things down to a level they can comprehend. Another part of this principle is to make sure that you can actually understand your patient. Now, if a patient was to come into your clinic and they couldn't speak English, it would be the onus would be on you to call a translator in so that you can understand them and not rely on family members or friends to do the translation. Principle number 3 is to obtain valid consent. Doing any treatment on a patient without valid consent is a form of assault, and it could lead to a lot of trouble. So that means that valid consent is where you explain the risks of a treatment, the benefits of a treatment, the prognosis of a treatment, and the alternative options that the patient could go for apart from the options that you are going to go ahead with. Another key thing to dive into with this is understanding what age or at what stage can a person actually be deemed to have capacity to make decisions on their own behalf. And this comes down to the pillar of Gillick competence. A person is Gillick competent where they are under the age of 16, but different children mature at different ages. And that means that sometimes, even though the child hasn't hit the age of 16, which is the legal age that they can consent for procedures, they may still have the ability to make decisions. So how do you judge that up? The DDU have recommended the CURB model, CURB. If the person can communicate with you and understand information and retain information and weigh up multiple factors to come to sound logical decisions, then chances are they are able to give consent for procedures. Principle number 4, maintain and protect patients' information. That is another way of saying maintain confidentiality. You cannot leak any information about a treatment that you've done on a patient to anyone, not family, not friends, and even if a patient rings the practice and asks for information on the phone, you have to have a very thorough process to make sure it actually is the patient, because we can't leak anything about them. The impact of this is that if something is leaked, patients will lose trust in the profession and therefore they may not feel inclined to come back to a dentist. This also refers to record keeping, Any notes that we take should be well hidden, Any information about the patient, such as study models, should not be left out in the practice for other dentists or people who don't need to see it to see. And these are just all important factors to consider. Principle number 5 is to have a clear and effective complaints procedure in every practice. And if a patient does want to complain, you should give them the right to exercise that complaint. That means referring them to the procedure, allowing them to voice their concerns, making them feel heard. And the way in which you should deal with a complaint is to respond to it promptly, give the patient a constructive response, and let them know what you might change in your own practice to stop that issue from happening in the first place. This ensures that trust is kept with the patient, and hopefully the goal with complaints is to resolve them locally rather than them escalating. Principle number 6 is to work with team members in a way that's in patients' best interests. Now, this means a lot of things, but it's quite common sense. It's about having a good dynamic with the team. It's about respecting other members of the team. It's about raising concerns if a team member is doing something wrong, and also looking out for the all-round well-being of your team, and also understanding different team members' roles and responsibilities so that when you are in clinic or you're giving a patient treatment or you're planning your schedule, you know how to work with the nurse versus the receptionist versus the hygienist so that everyone works collaboratively to do what's best for patients. Principle number 7 is about maintaining your knowledge and continuing to upskill your knowledge and your skills as well. Now, this comes under the concept of CPD, continuing professional development. Dentists and other members of the dental team have to hit a certain number of hours every 5 years. For the dentist, it's 100 hours every 5 years. And what does CPD look like? It can be a host of different things. Sometimes it's about building your skills, communication, teamwork related. Sometimes it's about revising medical emergencies and their management, so that if a patient was to have if a patient was to collapse in your clinic or have a heart attack or an asthma attack, you'd know what to do with it. This also refers to improving your knowledge and your skills. So going on courses to improve your clinical abilities, the way you do fillings, the way you do crown preps, the way you extract a tooth, and continuing to learn. Principle number 8 is raise concerns if patients are at risk. Another way we can simplify this is the term of safeguarding. That just means protecting patients if they're at risk of harm. So when you see a child, for example, you should be screening for forms of abuse, mental abuse, physical abuse, sexual abuse, cyber abuse, and the other forms. A common one is also neglect and dental neglect. And you should screen for these things because sometimes you may need to make a referral to get that family or child or person a bit more help, such as the Section 17 Referral Act, and sometimes the Section 47 Act under the Children's Act of 1989. Another part of this principle is to raise concerns if your colleagues are also making mistakes and damaging patients' well-being. And you should have no fear of reprisal when it comes to whistleblowing, because if there are genuine concerns, there shouldn't be a relationship in the practice where raising concerns is looked down upon. Principle number 9 is about maintaining good behavior in public and on social media. So this means monitoring your social media. Avoid exposing patients on social media through posting pictures or identifiable information. And also ensuring that your conduct in real life is in such a way that it maintains patients' trust in the profession. Now, that is a quick whistle-stop tour of all the 9 principles and some of the key points that you'd have to consider. And if you study these, then it leaves you in a really good position to approach ethical questions in your interviews. We'll wrap up there and thank you guys for watching. If you want to learn more content like this, then we'd advise that you sign up to our interview course or programs like the Interview Journey, where you'll get one-to-one coaching with a team member like myself.